Good evening, everybody. Thank you so much for joining us today for our V-STEAM workshop with Dr. Naomi Machimura. Dr. Naomi has over 17 years of clinical experience as an acupuncturist and Chinese medicine doctor. She offers acupuncture and functional medicine sessions characterized by a holistic approach, focusing on healing both mental and physical aspects of identifying and addressing the root cause of illness. By delving deep into the mind, she uncovers emotions linked to physical conditions, facilitating comprehensive healing and well being. Dr. Machimura received a bachelor's degree in Japanese language and literature from Otsuma Women's University in Tokyo, Japan, and in 2003 she decided to relocate to California to start her studies in Oriental medicine at Southern California University of Health Sciences, where she received her master's degree in acupuncture and Oriental medicine. After several years of practice, her passion for Oriental medicine led her to pursue a PhD in acupuncture and Oriental medicine from American Liberty University in Newport Beach. Dr. Machimura specializes in pain management, women's health and fertility, healthy aging and longevity, and here at Revive Chi, she offers acupuncture, Chinese medicine, mugwort and Chinese herbal V-steam, integrative functional medicine, NADA, protocols to treat substance abuse, emotional traumas, and PTSD, holistic microneedling, and MyZen cosmetic acupuncture for anti-aging. Welcome, Dr. Naomi, to my podcast. I'm so excited to have you as a guest. And of course, always so thankful that you are part of our team at Revive Chi. So we are particularly excited about this topic of V-steam, and this question comes up a lot in our practice. There's always signs about V-steam, and patients are always asking me, like, "Ooh, what is that?" It's very intriguing, especially when they find out what the V stands for. Then they're like, "Oh."
Mhm.
So, would love for you to tell us a little bit about yourself and how you found your way to Chinese medicine and what some of your specialties and practice passions are.
Okay, sounds good. Thank you very much, Dr. Yan, for long introduction. Uh,
You're welcome.
yeah, so I've been working as acupuncturist for almost 15 years right now in California, and I joined Revive Chi last summer. I'm very excited to helping lots of amazing women in your clinic, and especially related to V-STEAM is that place finally V-STEAM stand out. That's what I'm so looking forward to it. So when I found the V-STEAM when I was going to um, l- getting pregnant for my second son, and I was already 43 years old, and I've been having a hard time to get pregnant. And then my friend actually asked me, "Hey, why don't you try this feasting?" I was like, "What is this?" And then I just pop up over the chair, which was having some steamer under the stool, and then it was so cool. And then first time I tried, and then I really loved it. But that one is like it can bring from the she brought from the Japan, and very simple one. So it was very hard for me to sit for a long time. However, I use it for once a week or once a month at least at her home, and then enjoy that a lot. Then a couple months later, finally I was able to get pregnant. So
Hmm.
then I start offering this service to through my Japanese community women's, and especially for the ladies who wanted to get pregnant. They are almost close to 40 years old. But then some of them they got pregnant, or some of them, even though they went through the IVF protocol, but still they had a great successful. So I'm so confident to offer this service to your patient or our.
Wow, that's such a fascinating story.
Thank you.
Dr. Naomi. I didn't realize that you used it as well for yourself as part of your fertility journey. So
Mhm.
I'm really interested in the type of herbs that are used. Obviously, depending on what phase of life you're in as a woman, you would probably use different types of herbs. Is that correct?
Yeah, so the great things about this herb is, especially this this kit what I'm providing is from Korea. So for Korean people, I think the raw herb, herbal medicine is very close in their lives. So
Mm.
there's a three different brands, the formula for this V-Stim. One is originally for the gynecological issues, specifically to warm up the womb and then having blood circulation and helping for more pelvic issues, gynecological issues, everything. And then second is adding to that original formula there is for more detox formula. So enhancing liver detoxification, then having more sweating, and then maybe reducing more easy to get detox out from not only from uterus but also from the liver because that's the adding herb is stimulates the liver detoxification. And the second one, the third one, I'm sorry, the third one is for more improve enhancing immune system. So some of them who has seasonal allergies or skin conditions, those people are probably good to use that for herbal formula.
That's so interesting. So the herbal formulas are customized depending on the different conditions.
Yeah, kind of three different kinds.
So what about for patients that are going through perimenopause and menopause? Is there a special set of herbs specifically for that?
I would do, maybe we can, even including myself as a menopausal, postmenopausal woman, I would start from the detox because I always tell the patient starting from liver detox because that is the first things. Um, that's the key actually helping the balance of essential hormones. Then eventually, if you have some gynecological issues, shifting to the original formula. That's I would do as an approach. So perimenopausal is more tricky, right? Because most people still have period. So usually we offer, I will cover for that later on. However, if you allow me to say it, so V-stim is during after the menstruation up to ovulation period if you want to get pregnant. But then if perimenopausal, anytime after menstruation, you can start doing this steaming. Yeah, we got some questions. Yeah.
Okay,
Yeah.
shoot. Yeah,
No
go
problem.
for it. What was your question?
Well, it was about perimenopausal women,
hmm
how we going to offer and what kind of when is the good timing or that kind of thing. So, but I only one question.
Yeah, I kind of overheard the question about how if your periods are irregular,
Mm-hmm.
when do you
Mm-hmm.
come in? I would say that if you aren't cycling or if you're cycling very irregularly, it's probably okay to come in at any time. Wouldn't you agree,
Oh yeah, of
Dr.
course. As
Machimura? I
long
mean,
as
I really
yeah.
think the timing is for women that are trying now, like trying to get pregnant. Of course, we would then have to look at the timing of that to
Mhm.
V-steam prior to ovulation and the implantation window. But I think
Mhm.
for women that are not trying, or women that are in the perimenopausal menopausal phase, I don't think it should be an issue. But that kind of
Mhm.
brings us to the question of how often would you recommend somebody come in? So
Mhm.
if someone is coming in more for like hormone support, for
Mhm.
perimenopausal treatment, like maybe to kind of help with vaginal dryness and
Mhm.
some of the other issues that come along with perimenopause. Uh,
Yeah.
yeah, what
Yeah.
would you recommend?
So if still you have period, as I said, maybe after bleeding, after period,
hmm
you can come
hmm
and helping, of course, vaginal dryness and hot flashes, that kind of feeling. Because as Dr. Yang would say, the vaginal dryness or hot flashes are kind of kidney indeficiencies,
Mhm.
which is because of in declining, heat is going to flare up. So, but however, doing steaming, actually heat goes down. That's the unique things about the Oriental medicine, but actually that's true. We need to control sweating too. So even though you have hot flashes, by steaming from the bottom, your heat going down. That's
Mhm.
why, yeah, doing V-steam is more helpful to calm down your hot flashes too.
That makes a lot of sense to me. So it's almost like treating heat with heat, almost,
Correct.
right?
Hmm.
So if a patient is menstruating, would you have them come in on the latter part of their period where they're still just spotting or just completely done with their period?
Spotting, if it's after in the phase of finishing and this spotting, I think it's okay. But
Okay,
in starting, I wouldn't recommend to do this.
sure. Okay.
Mhm.
What about if a patient is coming in specifically for like gynecological issues like fibroids or
Mhm.
ovarian cysts, things like that? Is there
Yeah.
a time, like a specific timing for those patients too?
Again, I would say if they don't have any bleeding, they can
Mhm.
come,
Yeah,
right?
because I would imagine for patients with endometriosis or
Hmm.
like painful ovulatory
Hmm.
symptoms, which can happen
Hmm.
with PCOS patients, that the V
Hmm.
steam might actually help them, right? In terms
Yeah,
of
I
dealing
agree.
with the pain and
Yeah.
discomfort.
Hmm. Yeah, I agree with you.
Um, I did have a couple questions about the treatments themselves. Are there like any potential risks or cautions for V steaming?
If patients sit too long without drinking enough water, may
Hmm.
get like headache or something. So we have to be careful about length and frequency in each session. And third one is if patient doesn't know that if they have any sensitivity with herbs, may not have some reaction from the raw herb. So that's the
Hmm.
three things I'm kind of considering.
So in terms of, well, this brings a good question up too, is you said the timing is important. So how long is the typical V steam treatment?
Mhm. So far, mm, uh, 30 minutes, or if patient can tolerate 45 minutes.
Okay,
That's the
that
first
sounds
thing I.
reasonable. 30 to 45 minutes. Okay, and this is going to be a question that I'm sure a lot of people are going to ask in our clinic, would be, okay, well, can we do V-steam treatments and acupuncture? Can we
Mhm.
combine them together,
Yeah.
along with other modalities of Chinese medicine?
Yeah, that's gonna be a great idea, and some of them are enjoying that combination sessions. So either way, if you want to start with acupuncture first, we do acupuncture first, and then have them do V-steam and
Hmm.
relaxing, and then going home. And if you want to do V-steam first, then acupuncture, you're gonna have more relaxation, more like how can I say it? Like, so full relaxation during the acupuncture.
Oh,
So,
I would imagine people definitely fall asleep
yeah,
if they
I would.
V-steam first, right? And then
Yeah,
they knock out during acupuncture.
yeah.
That sounds very nice, that
Mhm.
combination.
Yeah.
Okay, great. And I don't know if you answered this about fertility support, but
Mhm.
I know you mentioned your own experience, but the timing for fertility treatments for
Mhm.
V-steam, it sounds like the V-steam can really help tonify the blood, help with
Yeah.
hormone balancing for fertility patients, or for just regulating menstrual cycle in general. And
Mhm.
did you mention the timing for treatment for fertility patients?
Yeah, and I would say the ideal timing for V-stim for the fertility patient after menstruation and before ovulation.
Okay.
So if your cycle is 28 days, maybe starting from between 5 to 12 days. That is
Okay.
the time.
That's like the ideal time frame.
Mhm.
So in a given natural fertility cycle while someone's trying, they would really only get 1 V-steam session in,
One or two, right?
1 or
So,
2. Okay, that
mhm,
makes sense.
yeah.
Okay, and then what if a patient is doing IUIs or IVF
Mhm.
treatments or
Yeah,
any type of assisted reproductive treatments?
right. Of course, definitely going to be helpful. So, but I would suggest starting maybe 1 or 3 months before starting to the IVF, IUI
Mm,
treatment will be very, safe because we don't want to interact any any situation with medication they are taking and then adding
mhm,
Chinese formula even through the vagina, but still may not affect the outcome. So we don't want to
okay.
adding the interactions.
So it would make sense to maybe stop the V-steaming prior to them starting IVF medications?
Yes.
Okay, alright, that makes sense. And what
Mhm.
about if a woman is on bioidentical hormones?
That's great.
Medications
Well,
like that, like, is there any contraindications for that or any benefits to combine the 2 together?
I think it's good there's no problem to combine with bioidentical hormones because
Mhm.
I'm thinking, you know.
Yes.
Yeah.
Right. Okay, great. Well, I would imagine if anything, it's going to help with hormone balancing, right?
Mhm.
And hopefully help with your estrogen production too, or supplementing
Mhm.
estrogen at least.
Mhm.
So I know I'm kind of touching on all the phases of a woman's life. I think the only one that I didn't ask about really was about postpartum recovery. I'm assuming we don't V-steam when we're pregnant. Is that
Mhm.
correct? Okay.
Correct.
All right. But what about after you have a baby, and when would it be safe to actually have a V-steam herbal treatment?
Yeah, so Vistimi actually is traditional practice for postpartum recovery. So that's why it's actually I think Korean women ancient time or even now doing very actively doing visiting at home as a
Mhm.
home care. So usually if vaginal birth, if there's no or very mild tears, probably 3 or 7 days after delivery, you can
Mhm.
do visiting. And if moderate tearing, or they have stitches, maybe better to wait 2 to 3 weeks.
Okay.
And if someone has a C-section, maybe better to wait 4 to 6 until the incision heals.
And how would V-steam help with these patients in the postpartum recovery?
So first of all, uterine recovery, by helping expel lochia or prevent clotting or support the uterus in shrinking back to the normal size. And
Mhm.
then also pain or perineal healing. So
Mhm.
by getting the herbal steaming, soothing the discomfort and reducing swelling and maybe bleeding a little bit, promote tissues repair and also hormonal balance and mood support. That's why it's good to prevent the postpartum depressions by getting these
Mm.
services. And also vaginal and pelvic floor health, because by getting the herbal steaming, helping with dryness, elasticity, and muscle recovery.
Wow, that all sounds amazing. It
Mhm.
I was going to ask about pelvic floor health in general. I
Mhm.
just had an interview with a pelvic floor therapist that talked a lot about pelvic floor health in all stages of a woman's life.
Mhm.
So I feel like V-steam is kind of similar where we can use this type of modality to benefit us too. So can you talk a little bit more about how V-steaming can help with pelvic floor health in general
Yeah,
for all?
yeah. So pelvic floor is so underestimated symptoms. Um, I actually had the uterine prolapse situation because
Mhm.
after deliver two babies, post 40 years old, I was so afraid of doing jumping or jump rope because my
Sure.
uterus went, ooh, and then, leaking also. It was very severe.
Mhm.
So doing this V steam definitely help to having more circulation around the muscle layers around the pelvic floor. At the same time, from my experience, maybe adding bioidentical hormone is helping to stop prolapsing a uterus and helping
Mhm.
that. Or,
That makes a lot of sense. Yeah. You're incredible, Naomi. I love the way that you've incorporated these treatments into your own like day-to-day life and recovery. I think it's so great. I always
yeah.
joke about how as practitioners, we're kind of our own guinea pigs, but
Yes,
you've like
exactly.
lived this, and I think
Yeah.
just even your fertility journey is incredible. Just
Hmm.
hearing about, having your two children in your
Yeah.
40s. I mean, as you know, our practice is so abundant with fertility patients, and I'm so thankful that we get to treat these women. But I also know
Mhm.
how challenging it is for women that
Yes.
are coming in for
Mhm.
treatment, whether it's natural fertility or some type
Yes.
of IVF or reproductive
Yeah.
assistance. So I
Totally.
think that being able to offer them something that can help strengthen their pelvic floor and support their mood too is
Mhm.
huge.
Oh, yeah.
Because I
It
mean,
is huge. Yes,
yes.
it is
Yeah.
huge. Hmm.
hmm
Yeah.
So, I mean, we can't, I feel like the mood aspect and the emotional aspect, unfortunately, Western medicine doesn't address very much. So
Hmm.
I think that as women, we kind of are, I don't want to say dismissed, but kind of dismissed when we're, kind of going into the postpartum blues or,
Hmm.
we're getting really irritable and cranky when we're menopausal and perimenopausal. Boy, that in itself is a whole nother experience. Just speaking from my own situation, I didn't realize, how
Hmm.
challenging that can be, and
Hmm.
that there's really, not a whole lot that can be prescribed
Hmm.
aside from like antidepressants and, sleep medications like Ambien when you're going through the transition, because that is all part of our menopausal symptoms is insomnia, depression,
Hmm.
and anxiety. And it's
Hmm.
unfortunate when I see patients coming in that are already kind of going through that transition. They've already been treated by Western medicine and they're on a bunch of medication,
Hmm.
and they're even before bioidentical hormones, they're
Yeah.
already on some type of antidepressant and
Hmm.
some type of sleep aid,
Yes.
unfortunately. And so
Yeah.
I think if we are able to address this earlier, I feel like we
Hmm.
can help women to not
Yeah.
have to go down that route because, I mean,
Hmm.
when you're not sleeping, you get desperate. I mean, that's
Hmm.
like it's your faculties, your cognitive function is impaired. I mean, all of it. So I
Hmm.
know why women end up taking those medications because
Hmm.
you have to, because you want to
Hmm.
like be able to do your day to day, fulfill
Yeah.
your job, be there for your
Hmm.
family.
Hmm.
But whatever we can do, I think from a natural medicine standpoint to help
Hmm.
our patients. And it sounds like I didn't even think about the emotional aspect and support of
Hmm.
V-stemming too. So thank you for
Hmm.
bringing that up.
Yeah, yeah. Anybody who had the experience of bee sting, their face change and then they get
Mhm.
so relaxed and then even when they go home, they feel more tender, they feel more like loving to, husband and then, their kid. So
They're
that's great
just in a,
study.
it just, it's like a mood lift, right?
Yeah,
I love that.
exactly. Yeah.
Now, so is there anything that a patient should do before V-steam treatment to prepare and then also after?
Hmm. So before, definitely drink a lot of water. That gonna have a better benefit, a better outcome after or during the steaming. And after, I would usually say do not take shower immediate because you receive all the benefit from the raw herbs. We use 10, more than 10, 15 kinds of Chinese herbal formula. So I want you receive the all the benefit from the all the skin and then embrace it and then enjoy the flavor in next maybe 6 hours and then finally you can take a shower. please do not, wash off everything quickly.
Okay, that
Mhm.
makes sense. And is there a limit to how long to wait? Like if a patient's like, "Ooh, I really want
Yeah, it's
to
pretty,
soak in all the benefits of the herbs."
yeah,
What
maybe
would
two
the
hours. Yeah, two to
how
three
many
hours. 2 hours.
3 hours? Okay, okay. So I can see my patients going, I haven't showered in 24 hours. So, okay, 2 to 3 hours. That sounds fair.
Yes.
And then, what about V-steaming at home? I know a lot of patients have asked about this, especially if they're, postpartum and they just had a baby, but they want the benefits of V-steaming, and maybe it's hard for them to leave the house because they don't have
Yeah.
baby care or they're
Totally.
nursing.
Totally. Yeah. Please try to get, at home. And there's so many simple V-Steam kit selling, maybe Amazon, I don't know. Maybe very simple one. Then maybe you can enjoy anytime when you feel to, even before sleep or Sunday morning. Sometimes you can find the time. Then that gonna make your life as a ritual habit.
Hmm,
Then
that's
have a
nice.
yeah nice daily uh, habitual things to have um, healthy women's life. So not only just postpartum patient, also menopausal, perimenopausal, or even before getting pregnant, or even like during the how can I say teenagers. Anybody who
Mhm,
has menstruation, I would
mhm.
I would recommend to have this one or do this one anytime.
For the younger women, would it be a shorter steam?
Depends if they have very severe, cramping or menstruation,
Mhm.
heavy bleeding. They still need to do this often as possible, right? So, but then if it's too much heat for teenagers, maybe 30 minutes per one session could
30
be enough.
minutes?
Mhm.
Yeah. Well, this kind of brings up a good question too. What are some of the common conditions that you've treated with
Mhm.
feasting?
Well, I've been seeing a lot of women, my age, like okay, even either want to get pregnant or postpartum or perimenopausal or postmenopausal. So I haven't seen many young women, maybe. Maybe they don't have any idea. Oh, why don't I do feasting? Maybe for
I think they have to have a mom that's one of our patients that'll bring them in. I think that's
yes,
usually how it goes, is
yes,
it usually comes from your mom, right?
right.
Like your
Yes.
mom says, okay, you need some extra support during your menstrual cycle, so come in for a treatment, which I really hope that more moms are able to do that for their daughters
Mm-hmm.
so that they
Mm-hmm.
don't have to turn to pain medications and birth control
Correct.
or
Yes.
menstruation issues.
Yes. Yes.
That would be my dream is
Yes.
that, younger women get educated,
Correct. Definitely.
a lot sooner.
Mm-hmm.
I feel like
Exactly.
right now, majority of the younger women are placed on birth control for a variety of
Yeah.
reasons, anything from
Mm-hmm.
like acne to
Mm-hmm.
PCOS to irregular
Mm-hmm.
menstrual cycles
Mm-hmm.
and painful menstruation. But if they have alternatives, like acupuncture,
Yes.
V-steam, Chinese herbal
Yes.
medicine in general, I think it
Yes.
could be so helpful that they don't
Mm-hmm.
have to get on the birth control. But this is totally going off topic because I can like totally get on a soapbox about the overprescription of birth control and how it
Mm-hmm.
impacts your fertility in the future. And
Yes.
and that's really the trend that I see is a lot of our fertility patients are coming in for, IVF support and they have been on birth control for 20 years straight.
Yeah.
And they started because they had some kind of hormonal issues as a teenager.
Mm-hmm. Mm-hmm.
Or maybe they started in college, but I don't think anyone's ever stopped to say, "Hey, do you think you might want to take a break?
Mm-hmm.
Maybe see how your cycles are naturally on their own, and maybe you don't need it."
Mm-hmm.
So, anyways, it's just a trend that I see a lot in fertility
Mm-hmm.
patients that they're
Yeah.
on long-term birth control use. So,
Mm-hmm.
and then they have a hard time getting pregnant because their hormones are flatlined
Correct.
after
Yes.
20 plus years. So,
Yes.
if we can have these alternative things for women to
Mm-hmm.
deal with hormone imbalances, that is is the dream.
Mm-hmm.
So yeah, so V-steam at home. So where would patients get the herbs for home use?
Yeah, we can offer for that. We can provide it. We have raw herbs made in Korea, and it's actually oral intake level of very high quality of raw herbs. So we can provide a kit, oval formula package. If you have a kit at home, that's another service we can provide.
Nice. And I
Mm.
like that they're custom blended too for
Yeah.
each patient. Yeah.
Yes.
Okay, great. Well, thank you so much, Dr. Naomi, for
Thank you,
answering
Dr.
all of my
Yang.
questions. I will definitely open it up for other questions. But
Mhm.
before I do, I just wanted to ask, is there any advice that you wanted to share with women that are on the path to motherhood or women that are transitioning through one of the golden phases of life, whether it's, having, starting their period, having children, or transitioning to perimenopause and menopause. I really do
Mhm.
think it's a golden opportunity for us to grow,
Yeah.
to grow and to persevere and get stronger as women. So,
Yes.
any advice you have to share?
Yeah. Just recently, or maybe in last couple of years, I realized how it's it's important to let it go the attachment. I was maybe trying to achieve higher goal, pushing myself to the limit and try to do more than I could do. And then I was like, okay, maybe sometimes some point ruin my health. Sometimes
Mm,
I'm very hard on not only myself to my family members as well. And even though, having hard time to keep doing my business too, but eventually I realized the more I age, the more I realized, okay, it's okay to let it go of attachment, you know. We better not to expect too much outcome. So once I let go of some attachment, I become more free and more enjoyable each moment and even each relationships. So just then I can embrace how I am, just how I am. I don't need to become anybody else. And it's okay to make a mistake. It's okay to it's okay somebody disappoint at me because I cannot do more than how I am, right? So that's how I learned recently.
I love that. That's great advice. Just being authentic to your true self and
Correct.
accepting yourself
Yes.
for who you are too. I love
Mm-hmm.
that. That's great advice.
Mhm.
Any other things that you wanted to share about your practice or anything coming up for you?
So one thing I forgot to mention is for the a pregnancy lady who passed the due, actually visiting is
Mm,
helping, very
okay.
helpful, yeah, to a kind of inducement.
Hmm.
So, some midwife use this to keep the bee steaming when
Okay.
they're going to have a baby. So having the heat and open up the uterus and then
Sure.
is
So
it
it
for
can help with like dilation and
yes,
like softening of the cervix.
yes.
Okay. Very
Mhm.
cool. So what phase of pregnancy would that start? Like after 40 weeks, right?
Yeah.
Okay.
Yeah. If someone say, okay, I'm ready,
Yeah. Yeah. They're so ready by then.
Yes. Yeah.
Okay. That's a
Okay,
that's a
time for the
great
bee
tip.
steam.
I'm
Yeah.
glad you mentioned that.
Mm-hmm.
That's I mean at that point you're doing anything.
Mm-hmm.
So, all right. Well, thank you so much, Dr.
Okay, Dr.
Naomi,
Yang.
for
Mm-hmm.
all of your expertise and sharing so
You're
much
welcome.
interesting information about V-steam.
Thank you
I
for
am
having me.
really excited to try it myself and,
Mm-hmm.
being able to offer some of the custom herbal blends to patients too for home
Yeah.
use.
Mm-hmm.
Yeah. So I'd love to open it up to everybody else if you have any other questions.